Hey guys, Dr. John Sanders here, family physician with Voyage Clinics podcast, and I wanted to talk just a little bit about common things that I see in my practice. Common thing number 2 is going to be around the lips. So number 1 is angular cheilitis. So like you'll sometimes get a cracked corner of the mouth. It can happen in all age groups, and this is called angular cheilitis and is very, very common. Most common cause for angular cheilitis is a little yeast infection. So there's like a little fungus in there. So we typically just treat that with topical antifungals, so prescription stuff, and it'll go away and it'll calm down. There are some B vitamin deficiencies that can drive this, as well as some mineral deficiencies and things like that as well. So worth a discussion with your doc, briefly talk about it and go over, treatment and things, how to handle that. So angular cheilitis, just a cracking of the corners of the mouth, really, really common. Treat it with antifungals initially. If it doesn't go away, consider other causes, including vitamin, mineral deficiencies. Okay, sometimes around our lips, we also get like chapped, cracking lips. Chapped lips, do we need chapstick? What's the deal with chapstick? So the answer is sometimes. So I grew up in high mountain desert, Nevada. So lots of chapstick, lots and lots of chapstick. And then went to UNLV for undergrad. Again, really high, really dry climate. And so lots of chapstick. And then Florida for medical school, humid, hot. Almost never did I have to use chapstick there. And so, and then back here, I'm now in Utah and really high mountain deserty. And so chapstick is definitely a thing. But I'll tell you a secret. So if you're having to use chapstick a lot and you live in a dry climate, I want you to check your hydration status. So make sure that you're taking in at least 100 ounces of water a day if you're in a dry climate. You may not sweat as much. Like in Florida, I sweated like crazy because it's humid all the time. But here I don't sweat very much. But I am sweating. It's just evaporating really quickly and it's really dry outside. And so a lot of people get behind the 8 ball for hydration status and their lips gets really chapped. So make sure that you're staying really well hydrated first and foremost. Then chapped lips you can benefit from some chapstick. Chapstick almost always has lanolin in it. And so sometimes, not all the times, but this has happened to me actually, you'll get like this really red, like irritated lips, like even around your lips is really red and irritated. And it can actually be a reaction to the lanolin in the chapstick. So something to be aware of. If that happens to you, stop chapstick. You have to stop it. You can sometimes just use plain Vaseline or just let your lips heal and recover. But plain Vaseline doesn't have lanolin in it. Aquaphor has lanolin in it. So some people get lanolin sensitivity and their lips get really fussy and chapped. And so those are the lip things. We already did one about cold sores, very common. And so I'm gonna defer to my cold sore video that's on my YouTube channel. You can just check that out. The other one though that I do want to talk about briefly is aphthous ulcers. These are canker sores. You get them sometimes on the inside of your lip, sometimes on the inside of your mouth, sometimes on the roof of your mouth, sometimes in the back of your throat. Aphthous ulcers, APHTH, aphthous, kind of like ophthalmology. I don't know why they do OPHTH, APHTH. But anyway, these are canker sores, very, very common. And if you get them very regularly, you might want to talk to your doctor because it can be indicative of other things going on with you. But they are also just very common. Used to be thought that these were caused from herpes simplex virus, but they're not. Just kind of almost like an autoimmune little thing that happens. And so we actually treat this with topical triamcinolone paste. It's an oral paste, works really great. It creates a little barrier right there and the pain and everything goes away right away. And honestly, like 2 days with the triamcinolone paste and it's gone. I personally use this. It's amazing. I was suffering with aphthous ulcers for a while here and there, and they're painful and they are terrible. And so it's nice to have just a brief, easy relief thing. And that is a prescription though. So you got to talk to your doc about that. So yeah, those are just mouth and lip things that we commonly see. And I wanted to just briefly talk about those. Hope this helps you. And don't forget to like and subscribe to our channel and enjoy life's journey.